This is the MRI Contrast and NSF lecture. By the end of this lecture, students should be able to identify 5 qualities of a good contrast agent, describe paramagnetic contrast agents and how they affect T1 relaxation, identify the difference between paramagnetic and superparamagnetic agents, identify the process and bonding agent that is used with gadolinium, identify clinical applications of MRI contrast agents, and describe how MRI contrast agents are used for tumor localization and how the blood-brain barrier affects enhancement. Students should also be able to identify the 5 different levels of chronic kidney disease, describe what NSF is and what precautions we need to take with patients that are at risk for it, and describe what GFR stands for, what it measures, and how creatinine is used to calculate it. Properties of a good MRI contrast media are that it will alter or change tissue contrast at low concentrations. The effect on tissue contrast should be dose-dependent, meaning the smallest amount of contrast given should produce the desired result for that patient. MRI contrast agents should be non-toxic and non-reactive with the patient. They should be able to be cleared quickly from the patient's body. MRI contrast is measured or expressed in millimoles per kilogram or milliliters per kilogram. Effective dosages for patients are 0.1 millimoles per kilogram of body weight, which is 0.2 milliliters per kilogram, or approximately 0.1 milliliters per pound. The maximum allowable dose for any patient is 20 milliliters. To understand how MR contrast agents work, we first need to review some basic concepts on proton density, T2 and T1 weighting. Tissue weighting is covered in Chapter 2 of MRI in Practice. First, we will look at proton density weighting. The proton density is the relative amount of mobile water and fat protons that are in a sample of tissue being imaged. Proton density is responsible for the initial height of the FID, or free induction decay. Properties of a proton density weighted image are a relatively long repetition time, or TR, that is greater than 2,000 milliseconds, and a short echo time, or TE, that is less than 20 milliseconds. Tissues that have high proton densities like CSF, tumors, and fat will appear bright on the MR image. Properties of T2 weighted images are a long repetition time that is greater than 2,000 milliseconds and a long echo time that is greater than 80 milliseconds. Tissues with long T2 relaxation times, such as water or tumors, will appear bright on the MR image. Tissues with short T2 relaxation times, like fat, will appear dark on the MR image. Properties of a T1 weighted image are a short repetition time that is less than 1,000 milliseconds and a short echo time that is less than 20 milliseconds. Tissues with short T1 times, like fat, will appear bright on the MR image. Tissues with long T1 relaxation times, like water or tumors, will appear dark on a T1 weighted image. Paramagnetic and superparamagnetic agents are all metal ions or crystals that act like small bar magnets. They develop a magnetic moment when introduced into a magnetic field. Magnetization is induced within the contrast agent. Hydrogen atoms in the vicinity of the contrast agent experience the magnetic field of the contrast agent together with the applied static magnetic field of the scanner itself. This increase in net magnetization shortens T1 and T2 relaxation times. Net magnetization refers to the low energy protons in the patient's body that are aligned within the main magnetic field. Just remember that the contrast agent actually develops its own magnetic field and therefore shortens the T1 and T2 relaxation times in the tissues around it. The result from the net magnetization of protons that come in contact with a paramagnetic contrast agent is that they will experience a shorter T1 relaxation time and a shorter T2 relaxation time. With normal doses of a contrast agent, this effect is seen mostly as the shortening of the T1 relaxation time and as a brighter signal on the post-contrast images. In this graph, the top line or post-contrast line depicts the net magnetization of protons which comes in contact with a paramagnetic contrast agent and experiences a shortened T1 and T2 relaxation time. Diamagnetic substances like gold and silver show mild negative effects on the local magnetic field within the nucleus of an atom. Paramagnetic substances such as gadolinium chelates have a positive effect on the local magnetic field. Superparamagnetic substances like iron oxide have a large magnetic moment and create large disruptive changes in the local magnetic field. Ferromagnetic substances like iron or lead acquire large magnetic moments when placed in a magnetic field and retain this magnetization even when the external field is removed. Once the gadolinium has been administered intravenously, it enters the pulmonary circulation, systematic arteries, and then enters the vascular space and across capillaries into the interstitial space, except for the CNS and testes, which are not permeable. It then crosses the renal glomeruli and into the urinary system. MRI contrast travels through the three phases of circulation: arterial, blood pool phase, and extracellular. Once the contrast is in the interstitial space, it causes fluctuations in the local magnetic fields. Water will relax faster with the presence of a paramagnetic contrast agent and therefore cause its T1 and T2 relaxation times to be shortened. Gadolinium is bound or chelated to another substance that increases the speed that the contrast is excreted from the body. This substance, DTPA, also reduces its toxicity level in the human body. The result is GD-DTPA. Gadopatentate is a relatively safe water-soluble contrast enhancement agent for MRI. Paramagnetic contrast agents, or T1 agents, are based on the gadolinium atom. The principal image contrast from a paramagnetic contrast agent is the result of shortening the T1 relaxation time of tissues. The result of T1 relaxation is bright tissue and is the desired effect of MRI contrast. MRI contrast differentiates normal from abnormal tissue and can be very effective in diagnosing disease or pathology. Imaging techniques that emphasize T1 relaxation should be used to maximize the effect of the contrast agent. Common pulse sequences used are short repetition time, spin echo, or fast spin echo sequences, and inversion recovery sequences. Some paramagnetic contrast agents used in MRI are Magnavist, Prohance, Omniscan, Optimark, or Multihance. Depending on how the gadolinium molecules are balanced in solution, they produce either ionic or non-ionic contrast agents. Magnavist is an example of an ionic contrast agent because its two negative charges are balanced with two positively charged meglumine ions, therefore making it an ionic contrast agent. Prohance, Omniscan, and Optimark are gadolinium-based agents that have been balanced to produce non-ionic contrast agents. In general, the non-ionic gadolinium-based agents have lower osmolality and viscosity, which increase digestibility at greater concentrations and make faster bolus injections possible. Multihance is often used in patients that have a decreased renal function. Because it has twice the relaxation properties of other gadolinium-based contrast agents, we are able to use half of the amount, therefore decreasing possible toxicity in the kidneys and the chance of the patient developing NSF. These are pre- and post-axial T1 weighted images of the brain. A left parietal tumor shows contrast enhancement due to a shortened T1 relaxation, causing a bright signal on the image. Gadolinium is classified as a rare earth element. Its atomic number is 64, where it has 64 electrons and 93 neutrons. Gadolinium has a silverish color and has 6 different energy levels. Superparamagnetic contrast agents, or T2 enhancement agents like iron oxides, are used to shorten the T2 decay times in tissues and therefore decrease signal intensity on T2 weighted images. Iron oxides shorten relaxation times of nearby hydrogen atoms and will reduce the signal intensity in normal tissues. This will result in signal loss on proton density weighted or heavily T2 weighted images. Feradex is an intravenous T2 contrast agent that can be used to evaluate the liver. GastroMark is an oral T2 contrast agent used for MRCP or MR cholangiopancreatography imaging. Make sure to review iron oxide safety and iron oxide side effects, contraindications, and iron oxide administration in Chapter 11 of MRI in Practice. There are different ways MR contrast is used depending on the anatomy or pathology being imaged. MR contrast agents disperse through the body very rapidly. The highest concentration of the contrast agent for imaging is within the first hour of administration. Post-contrast images that are acquired soon after the administration show the greatest change in signal intensity. Some applications require delayed imaging to allow contrast to wash out of normal tissue and show maximum contrast between pathology and surrounding tissues. MR contrast agents are used to increase the signal intensity of tumors on T1 weighted images. The appearance depends on the location, type of tumor, and timing of the post-contrast images. MRI contrast agents do not cross an intact blood-brain barrier. Where the blood-brain barrier is disturbed or broken, contrast can enhance abnormalities that cannot be seen otherwise. Perfusion techniques combine contrast administration with a very fast image acquisition. Perfusion techniques can show blood flow, blood volume, and tissue perfusion of organs such as the brain and the heart. A bolus injection with fast imaging techniques in MR angiography can show arterial and venous flow. The MR contrast agent increases the signal from blood and T1 weighted sequences. Some of the uses of gadolinium in imaging the central nervous system include tumors, pre- and post-operation, pre- and post-radiotherapy, infection, infarction, inflammation, post-traumatic lesions, and post-operative lumbar disc disease. Normally, contrast agents cannot enter the central nervous system. They are unable to cross the blood-brain barrier that protects the brain from substances in the blood. These extraaxial areas are outside of the blood-brain barrier and will show normal contrast enhancement. Areas within the central nervous system, like infarcts or tumors which have broken the blood-brain barrier, will show contrast enhancement. Many types of pathological conditions can disrupt the blood-brain barrier. Contrast agents can enter brain tissues in areas in which the blood-brain barrier is disturbed and increase the visibility of different types of brain abnormalities. In some cases, lesions that cannot be seen otherwise will become visible. Visualization of small lesions, such as early metastasis, may require delayed imaging or an increased dose of contrast to visualize all of the lesions. If there are a significant number of lesions, this may change how the patient's treatment is managed. MRI contrast agents can be used to aid in the visualization of many different pathologies of the spine, including spinal cord lesions, multiple sclerosis plaques, spinal cord syrinx, and infectious diseases such as AIDS or abscesses. In patients that have had a discectomy, particularly in the lumbar spine area, contrast agents can help distinguish between post-operative scar tissue and a new disc bulge. Lesions in the bone and the metastatic bone lesions can also be visualized post-contrast injection. Many abnormalities in body imaging can be seen on the T2 weighted image, but the use of a contrast agent in MRI allows for the visualization of extremely small tumors and improves delineation of tumors' edges or margins. Dynamic contrast enhancement can be helpful for imaging vascular organs such as the kidneys, liver, spleen, pancreas, adrenal glands, and vascular structures of the abdomen and pelvis. Both early and delayed images may be useful, depending on the suspected pathological condition. The use of a contrast agent may also aid in the differentiation of a benign versus malignant lesion. Dynamic MR imaging of the heart can be used to detect myocardial infarctions. Perfusion techniques are used to measure blood volume. Areas of myocardial infarction will not enhance immediately following a contrast injection. Around 10 minutes after injection, the scar tissue will then enhance. MR breast imaging uses dynamic scanning, fat saturation, and tissue subtraction techniques to detect small lesions in the breast that mammography sometimes cannot. Malignant lesions can be determined if they enhance rapidly and/or are spiculated in appearance. MR contrast agents in musculoskeletal imaging can be used to enhance soft tissue tumors, abscesses, infection, and inflammation of muscle or tissue. MR orthography is the most common use for MR contrast agents in musculoskeletal imaging. The contrast is mixed with saline and injected into a joint space, and in conjunction with fluoroscopic radiography techniques, the exam is performed. MR orthography increases the visualization of intracapsular structures like the glenoid labrum. MR contrast media can be helpful in MR angiography by identifying stenosis in the vessels being imaged. It can also be helpful with breast imaging by displaying small lesions or tumors that cannot be picked up with conventional mammography or ultrasound. Both of these images are T1 weighted pulse sequences, and the contrast appears bright on the image. In any MRI protocol where contrast is routinely given, we must always use a pre- and post T1 weighted pulse sequence. The way tumors and other pathologies enhance on the T1 images is how we can tell them apart from other structures. Having the pre-T1 weighted sequence acts as a baseline before the contrast is administered and is very important in determining pathology. Oral and rectal contrast agents aren't used very often in MRI. In facilities that do choose to use them, there are several different contrasts available to enhance the bowel. Oral iron oxides and fatty substances can be used to highlight the bowel. Some facilities use blueberry or pineapple juice to create a negative contrast in the gastrointestinal tract to allow other structures to be visualized. Dilute gadolinium and dilute barium solutions can also be used. Air can be used to distend the rectum and demonstrate the prostate in males and the uterus in females more effectively. Antispasmodic agents can be used in the gastrointestinal MRI studies to decrease peristalsis in the bowel, and ultrafast imaging techniques can also help decrease bowel motion artifacts. Generally, for MRI abdominal or pelvic studies such as the liver, pancreas, kidneys, or MRCP, a 4-hour NPO prep is used. For specific studies such as MR enterography, patients may be asked to use a laxative before drinking the oral contrast. These studies require the patient to arrive early and drink an oral contrast agent. MRI contrast agents are much safer than the iodinated contrast agents used in CT. Contrast reactions seen with MRI contrast agents are minimal compared to reactions seen with the iodinated contrast agents used in radiography and CT. There are, however, potential risks associated and can include an increase in bilirubin and blood iron levels. The most common side effects are mild headaches, nausea, vomiting, hypotension, gastrointestinal upset, skin rash, or hives. Other reactions can include neural spasms, nasal and earlobe edema, whole body redness, breathing difficulties, and anaphylactoid reactions. These occur in less than 1% of patients. Irritation at injection site and delayed reactions including hypertension, vasovagal responses, and syncope. It is very important to monitor any patient getting a contrast injection very closely. If a patient does have an anaphylactic reaction to gadolinium, which is extremely rare, they may not be able to communicate, and the MRI technologist must keep in verbal and visual contact with the patient and be aware if something is wrong after the injection. In most cases, we will be on hand injecting our patients for routine protocols, but for some, where we need to use the power injector for a dynamic injection, we may not be able to talk to the patient until after the dynamic sequences has run. In these instances, it's very important to watch the patient for any signs of distress and be ready to assist the patient if necessary. There are several situations where we should use caution before giving MR contrast. They include pregnancy and lactation, patients with any respiratory disorders, asthma, or any prior allergic history to IV contrast materials, and patients with any blood disorders such as hemolytic and sickle cell anemias. Sickle cell anemia is a disease caused by the production of abnormal hemoglobin, which binds with other abnormal hemoglobin molecules within the red blood cell to cause rigid deformation of the cell. This deformation impairs the ability of a cell to pass through small vascular channels. Sludging and congestion of vascular beds can occur, followed by tissue ischemia and infarction. The introduction of gadolinium in a patient with sickle cell anemia can result in a vaso-occlusive complication in the patient, which can result in tissue ischemia and infarction. It must be cleared by the radiologist or physician before injecting a patient with sickle cell anemia. MR contrast agents cross the placental barrier easily and are ingested and excreted by the fetus through feces and urine. Research in this area is still uncertain, and how fast the contrast agent is expelled from the amniotic fluid is unknown. We use a conservative approach to administering these drugs in pregnant patients. Unless the benefits outweigh the risks, we try not to use MR contrast in pregnant patients. If it is decided to use MR contrast agents, and this would be determined by the radiologist in conjunction with the patient's referring physician, written informed consent is needed, stating that the risk associated with the use of MR contrast agents during pregnancy is not currently known. MR contrast agents are excreted in very low concentrations in human breast milk over a period of about 33 hours following initial administration. It is recommended that nursing mothers express and discard their milk for 36 to 48 hours after the use of an MRI contrast agent before nursing again. Expressing milk for 36 to 48 hours makes certain that the nursing child does not receive the drug in any traceable amount. MRI contrast agents have been approved for use in children over 2 years of age. The safety of MR contrast agents has not yet been determined in children under the age of 2. No biological effects have been reported thus far in this age group. Nephrogenic systemic fibrosis is a gadolinium-induced disease that we have just started to see cases of in the past couple of years. NSF occurs in patients with severe renal disease. These patients are on dialysis and/or they are patients that are in kidney failure. NSF can cause fibrosis of the skin and connective tissue and can affect major organs such as the liver, kidneys, and pancreas, and can be fatal. NSF is found to be caused by chelated gadolinium contrast agents that are injected for MRI contrast studies. Patients over the age of 60, those who have renal disease, a history of hypertension or diabetes, need to have a serum creatinine drawn, usually within 6 weeks of the exam. Patients with severe liver disease or those who have had or are having a liver transplant must also be screened. Patients at the highest risk of developing NSF after a gadolinium injection have a GFR lower than 30 mL per minute. The GFR is a test used to check how well the kidneys are functioning. It estimates how much blood passes through the tiny filters or the glomeruli in the kidneys each minute. GFR uses the MDRD, or the modification of diet in renal disease equation, to calculate safe levels. The MDRD equation uses a recent serum creatinine level, the patient's age, weight, race, and gender to calculate the GFR. Creatinine levels are used as part of the calculation to determine a patient's GFR. Creatinine is found to be a reliable indicator of kidney function. If the kidneys become impaired, the creatinine level in the blood will rise due to poor filtration by the kidneys. Abnormally high levels of creatinine warn us of a possible malfunction or failure of the kidneys, and for MRI purposes, an increased risk for NSF. Normal creatinine levels are between 0.8 and 1.6. These levels may be different depending on the laboratory or MRI facility departmental protocols. Along with the creatinine level, several factors can affect a patient's GFR. The GFR will decrease with increased age. Men usually have more muscle mass than women, and the GFR calculation is adjusted for this. African Americans also tend to have more muscle mass than other ethnicities, and the calculation is also adjusted. The GFR value will tell us what stage of chronic kidney disease the patient is in. There are generally few to no symptoms in stage 1 and 2 chronic kidney disease. Early chronic kidney disease can be diagnosed when the patients present with the following symptoms: high blood pressure, higher than normal levels of creatinine or urea in the blood, blood or protein in the urine, evidence of kidney damage seen on an MRI, CT, or ultrasound scan, and a family history of polycystic kidney disease. Patients in stage 1 or 2 chronic kidney disease can have gadolinium injections with little to no risk of developing NSF. In stage 3 chronic kidney disease, anemia and/or early bone disease may appear and is usually treated to help the patient feel their best and reduce problems down the road. MRI contrast can be given to these patients if deemed medically necessary by the radiologist and the referring physician. Patients injected with gadolinium that have stage 3 chronic kidney disease are at a slight risk of developing NSF. The risk must be explained to these patients and they must be consented by the radiologist on duty. In most cases of stage 3 chronic kidney disease, an alternative contrast might be used, such as a Magnavist or Multihance, where the molecular structure of the contrast allows us to give less of it with the same effect as a full dose. This lowers the chance even more of any kind of adverse effects. When chronic kidney disease has progressed to stage 4, the patient will likely be on dialysis or in need of a kidney transplant. These patients usually aren't given contrast due to the increased risk of NSF, given the fact that their kidneys aren't functioning properly and cannot excrete the gadolinium from their body. If these patients need the contrast injection, and if it were a life or death situation, then it might be allowed as long as dialysis was arranged immediately after the MRI. Again, this would be determined by the radiologist and the referring physician or the patient's nephrologist. In stage 5 chronic kidney disease, the patient is in complete renal failure and has no kidney function. The patient will be on routine dialysis, and we do not usually inject these patients with gadolinium. However, just like in stage 4, if there is a life and death situation where this patient would need an MRI contrast injection, then it can be discussed between the radiologist and the referring physician or the patient's nephrologist. Dialysis must be arranged immediately following the MRI. These stage 5 patients are at the highest risk of developing NSF due to having no kidney function at all. There is potential for residual gadolinium to collect in the tissues that may cause fibrosis or fibrotic changes. Pay attention to the 5 stages of chronic kidney disease and their corresponding GFR levels. Also, you can see how age, gender, race, and creatinine levels can change the GFR. Many laboratories will estimate the GFR when performing blood tests, but the MR tech should always calculate the exact GFR to know what specific stage the patient is in. If the GFR is stage 3 or lower, the radiologist must be consulted before injecting the patient. This concludes the contrast lecture and NSF lecture in MRI.